So this is directly an answer to a challenge that I know a lot of people are having, and that is whether they should continue their marketing during the current COVID-19 crisis. And I want to answer this question directly and specifically. And the simple answer is yes, you should continue your marketing. But, and this is a big but, we need to think about what is marketing and what is the message and what problem are we trying to solve. So let's just dig a little bit deeper into that. So what is marketing, first of all? So the Chartered Institute of Marketing defines marketing as the management process responsible for identifying, anticipating, and satisfying customer requirements profitably. So we are looking at identifying, anticipating, and satisfying customer requirements. The key here is, what problem are your customers trying to solve? What are their requirements? If you identify, anticipate, and satisfy those requirements, that is what marketing is. Now, generally speaking, it's kind of in a regular society, we would be thinking about, well, their requirements could be they want to straighten crooked teeth, they want to replace missing teeth, they want to brighten their smile, they want to feel younger, more confident, all those kinds of things. And in that kind of situation, marketing is about identifying, anticipating, and satisfying the requirements of those customers. But in the society as we are at the moment in the COVID-19 crisis, things have changed wholly. Now, I want to show you just a little chart here. And this chart represents the relationship between our time horizon and stress. Now, our time horizon and stress will alter our ability to project into the future, to think about future things, is directly related to the amount of stress we have in our lives. So if we start at the bottom left of this chart, kind of around this area at the bottom left where stress is low, our time horizon will be in years. So when stress is low, we can think years ahead. So if we're in a personally good place and everything is okay and hunky-dory and we're not too stressed about things, we can start to make decisions that happen years ahead. So we might think about orthodontics, a couple of years treatment, and replacing missing teeth, which might take, certainly could take up to a year in the case of larger cases. But as that stress begins to increase, our time horizon, our ability to think further and further into the future will get less and less and less. And this is very much down to a Maslow's hierarchy of needs. So as as we get lower and lower down on that hierarchy of needs, we need to make sure that we have our basics covered. And as our basics are not covered, so if things like health and security are not covered, we find it very difficult to see beyond that to the next level and the hierarchy of needs. And it's exactly the same here. So people are very concerned about their livelihoods, their future, their ability to earn any money. Are they going to stay fit and healthy? Are they going to be able to see their family again? Particularly if they've got elderly relatives, their family they may be worried that they may die from the disease. Are they going to get the disease themselves? And so what happens is that those stress levels increase. And as they do that, their ability to think into the future and to think about these extra treatments gets less and less and less. Their time horizon goes down to days, hours, or even minutes. Which means that the needs and the requirements that we are then having to satisfy and identify of our customers has changed. Because stress has increased, they've got all these extra worries. Their their needs and their desires have changed to things that are much more immediate. So they will be worried much more about what if I get pain? What if I have a problem with my tooth? What if something happens? Who do I contact? Where do I go for help and advice? So these patients may actually be okay at the moment. They're not actually looking for anything, but they're thinking, what if? Where do I go? What happens if? we may have patients that say, that may have their problem may be, is it okay if? So is it okay if I leave this mildly dull aching tooth for a little bit longer? Is it okay if I don't come and see you because I've got a filling that I think needs to be replaced? So these people are sort of moving up that stress scale a little bit more. You might have patients that have a kind of a what do I do about problem with them. So what do I do about the fact that my gums are bleeding? What do I do about other dental concerns that I have? And they may want to contact you to ask specific questions. And then finally, right at the end of that scale, you're going to have patients that are saying, I need help now. I'm in pain now. I've got a dental emergency now. I need to contact you. So these are the needs of your customers that still need to be marketed to. Remember, marketing is about identifying and satisfying the needs of your customers. So these are now the needs of your customers. So this is what marketing should be focused around. So the patients that are okay now but want to know what happens if, communicate with them by social media, by letter, by email. Patients that have questions, is it okay if I live with this tooth for a little bit longer? Is it okay if all of those kind of questions? Perhaps think about rearranging your website with a frequently asked questions section, then sending an email and social media to patients to say, we've redone our website because we know lots of patients have got lots of questions and we're not able to answer them directly. Have a look at our website. But then you're going to have patients that are in the what do I do about? They have a particular problem that's unique to them. What do I do about? They want to contact you. How can they contact you? What is your phone system like? Is your phone diverting through you to you at home? I strongly recommend you have a video consultation for these types of patients. It will allow these patients to contact you if they need to. Now, I've got some practices that are doing it only for their patients that are on sort of a plan membership, which I think is actually a really good idea. They're saying, we are still here for you, and you are a plan membership patient. You've committed to us. We are committing to you. We are still here for you. Here is a video consultation. And also those patients that say that have that help me now, they want immediate help. Again, it's about your phone, your website. Have you got information on there that they can contact you in the event of that dental emergency? Now, not necessarily whether you believe it to be a dental emergency. It's in the eyes of the patient. If the patient feels they have a dental emergency, then they have a dental emergency. So contacting you, perhaps with a video consultation, you can put their mind at rest that actually they don't have a video consultation. And all of this is great marketing, because marketing is about identifying and anticipating and satisfying the needs of your customers. It's just their needs have changed in this situation. So yes, you do need to be continually marketing to satisfy the needs of your customers. And the profit side of that will come later, that this will pay dividends, that you've managed to build relationships, keep the relationships going with your patients and customers over this time. Now, I have created another video on how to set up a video consultation for free using Calendly and Zoom. So take a look through the other videos. I'll put a link to it in the comments below so that you can see that video as well. Any questions? Of course, I'm always here. Give us a shout. Take care now. Bye.